Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Inpatient mental health care is an essential, often life saving level of care that is still widely feared, misunderstood, and stigmatized, but it shouldn't be. Much like going to the hospital for short term acute treatment of a medical crisis or condition, going to an inpatient mental health care facility is simply what you do to get the right level of care when you or a loved one is in crisis. Not everyone who needs or wants therapy will need inpatient treatment, but some will. It's there for exactly when you need it and only for as long as you need to be there, with the goal of getting you stable enough to continue your treatment in an outpatient setting. Think of it as a brief stop to get you the help you or a loved one needs. Today, in one of a series of Brother Be Well conversations in our Parents and Caregiver series, sponsored by Blue Shield of California's Blue Sky Initiative, we're exploring inpatient mental health care with an expert on the topic. Please help me welcome Cherie Kreiner, registered nurse, former psychiatric nurse, and Vice President of the Capital City Black Nurses Association. Cherie, how are you? And welcome back to Brother Be Well.
I am well. Thank you so much for having me.
Really good to see you. Good to have you. Let's jump right on into this one, Cherie. What are some of the common conditions that are successfully treated, initially at least, via inpatient care?
Right. So, inpatient care is an opportunity for not only initial or acute treatment, but long term care. So, longer term care, more intensive therapy over time. So, it could be inpatient care after an acute situation where you're having psychosis or you're in a position where you are at risk of harming yourself or others. And so, you go and get that initial care and then longer term care. Or it can be as simple as a voluntary inpatient stay where there's a program that offers more therapy that's intense and steadily and over time. So, as we continue to talk today, we'll look at those individual pieces.
Looking forward to having that conversation. I've learned that someone can have themselves admitted to an inpatient treatment facility, or you can be committed to one. And as I was thinking about this talk, Cherie, I was wondering, I think that lingo, committed or being committed, is a part of what contributes to the stigmatization of inpatient mental health care. Would you please walk us through the process of someone being committed to a mental health care facility?
Right. So you're absolutely right, Michael. Definitely there's a stigma around the idea of being forced to do something or go somewhere. So there is a distinction. There are inpatient facilities where they're voluntary, where someone can actually go sign themselves in to do. And then there's those situations where it's outside of their control. And what we call that involuntary admission to inpatient stay, it's actually covered under the law. You may have heard people mention 5150, which is a statute that allows us as healthcare providers to protect someone from harming themselves or others after they've been assessed to be a risk. And we can hold them for up to 3 days or until their condition changes for that 3 days. After 3 days, if they are still showing the same symptoms, still presenting the same risk, then we are able to extend that hold up to 14 days, which is called a 5250. In that situation, the patient also gets the opportunity to have their case heard at a court to make sure that the healthcare providers are making the right decision because you are being asked to do something beyond your will. It's more than an ask. We're saying you have to stay here because of this risk to yourself or others. So there are safety nets in place to make sure that when us healthcare providers are making that decision to involuntarily keep someone admitted, that we are following all the rules and that it's absolutely necessary.
I get it. I understand it now. Really appreciate you walking us through that, Cherie. Regard to inpatient treatment services, I've also learned that there's a difference between traditional inpatient and residential treatment. We have a whole video that's exploring residential treatment facilities, but for the sake of this chat, can you differentiate between those two, traditional inpatient and residential treatment?
Right. So traditional inpatient care was the story I was just walking you through. There was some acute situation. You're being held involuntarily for treatment to stabilize or then set up and move you forward. Right. So there's psychiatrists, nurses, psych techs, a whole host of folks that facilitate the best treatment in that environment. And most people that are in a traditional inpatient setting are there under some sort of conservatorship or law, as I mentioned, to keep them there to get the treatment that's needed. The residential programs are really awesome because you have these areas where someone can live and have access to their medications and supportive therapies that are kind of more independent, right? So it's like an independent living residential inpatient space where you get all of your basic needs met, but also some additional support. Like you're okay to make some of your decisions on your own, but you may need someone to actually hand you your medication. In some residential places, they have the opportunity for someone to give you your meds versus you keeping them yourself to keep you on track. They have counselors and therapists and other supportive services available to set you up for success. So some people will, I guess the term you may have heard before is transitional home. Some people still call it halfway house, things like that. But that's exactly what it is. It's an opportunity to set you up for success to get you back on a path of living the most independent life that you can.
I really love these conversations, Cherie, because I have heard the term halfway house. I had no idea it was the same thing until you just said that. That's the colloquial term that we used to use when I was coming up. So thank you for helping me and others connect those dots. Really appreciate it. It's important, I think, to understand, or for everyone to understand, that it's your symptoms, not your diagnosis or your condition, that determine whether or not you need hospitalization. Can you flesh that distinction out for us, Cherie?
Absolutely, because you could have a mental illness and be totally stable, taking your medications, able to do all of your activities of daily living, and able to be in a situation where you're not harming yourself or others are at risk for that. You're not suicidal. So, just having a mental illness alone is not grounds for admitting someone into an inpatient setting, as well as you look at substance abuse or poly or multiple substance abuse. There's other situations that can lead you to a psychosis and have you have the need to be in an inpatient setting. So we definitely always look at the symptomology and the circumstance and assess risk and safety and ability to do all the daily things that you need to do. And based on that assessment, that happens from a team approach. So, physicians, nurses, techs, that's how they decide what's truly needed when it comes to involuntary inpatient stays. Now, there are, as we mentioned, inpatient stays that are more voluntary that you could sign up for that just offers more frequent therapy and supportive services that you may need to deal with what you're dealing with. Um, Some people may have heard them call it a day program. There are programs where people go and stay for the day and they go and live and sleep at their own residence, but they're getting that intense everyday therapy. So it really varies, and there's so many options out there being offered.
And I would assume that those options are weighed based on the condition or the symptoms. I would assume finances are a part of that. Some of those options are more expensive than others, so there's a variety of factors that go into which path someone might head down. Is that accurate?
Absolutely. Depending on your circumstance, your insurance or lack thereof, there's different levels of opportunity. There's something honestly for everyone. It may not be the same or maybe even your preference, but there are services down to free or no cost that are available in the community.
Really appreciate you sharing that information, Cherie. I'm wondering, and I would imagine the range is pretty broad, but how long generally can one expect to be in a mental health care treatment facility?
Well, you know, Michael, I've seen people in and out in 3 days. I've seen people in and out in 3 months. I've seen some people that I knew coming in a revolving door for 6 years. So, really, it's case by case. The goal is for every person to have a balance and stability for them to be able, like I keep mentioning, your activities of daily life, the things that we all need to do: eat, sleep, have safety, security, all those things. So the goal is to get everyone to their optimal level of performance that's within their wheelhouse. So it really does range anywhere from, like I said, 3 days to years of being, if the condition really doesn't change and there's no ability to promote to more independent levels of care.
I understand. I understand. Appreciate that too. Cherie, I'm wondering, we're talking about inpatient mental health care, and without asking too rudimentary a question, I'm just wondering, where does one go for that physically? Where do you go for this type of care?
Right. So, as we've mentioned before, Michael, inpatient mental health facilities have been dwindling year over year. There's just less and less resources. Part of that is because of the science. We know that we really should try to get people to live as independently as possible using resources. So, there's been a shift in how people are treated. So, that's one part. But then there's physically less actual places for people to go. So, starting with your primary care health provider, if you can get resources there, a hospital you go to through your insurance company, also the county that you live in, there are mental health and adult and child psychiatric services through every county where they give you a list of what's offered and where you can go. And if not in your county, neighboring counties. So it's really just getting out there, good old fashioned Google now, looking up what's available near you in your area and using all of those resources to get the best care that you can get.
And I would assume a part of that Google search might include a phone call or two. So I want to ask that question. Is 911 the number that someone should call if they think they or someone that's in their care is in need of this level of service? Or who do you call when you think you might need inpatient mental health care?
Right. So if you're in a situation where you or your loved one is at risk of harming themselves or others, whether it be attempting suicide, suicidal thoughts with a plan to follow through, physically being a threat or causing harm to others, not being themselves, and it cannot be maintained with the tools you have at home, and you cannot safely transport them to an emergency department, you can call 911. If you are in a city or county where they have mental health services that have urgent call lines, you can also call those lines and they can send out mental health professionals to help de escalate the situation. If you have someone, oftentimes a big one, Michael, is depression. Someone's really sad. They're so sad they can't get up and brush their teeth every day. They're not getting out of bed. They're calling into work every day. They're in a rut. They cannot get out of it. They may be having those sad suicidal thoughts, but maybe they're not physically going after anyone. So you may not know. That person may be someone that you do take into the emergency department to be evaluated, or you contact their mental health provider and let them know what's going on to see what level of help is needed. The important part is to get that initial assessment to see how they're doing, if anything can help, if there's any risk there, so that they can get the care that they need. So 911, mental health hotlines in your area, and then also just going right into your local emergency department as well. There are trained professionals there to help get you where you need to go after the initial assessment.
I appreciate you walking us through that as well, Cherie. There are a lot of different situations that might necessitate a different approach. So you mentioned getting your loved one yourself to the emergency room as an option, but if you can't do that, some of those other resources are available. Really appreciate